This is Fit to Succeed in partnership with NordicFitnessEducation.com with hosts Ben Pratt. Thanks for joining us.
Because the stressor from training is just one big aspect of whether they're going to recover well enough. And I think you must understand where training fits within the sort of the bigger 360 picture of what actually is happening in your life at any one time will determine how well you recover from training.
Hello and welcome to another Fit to Succeed podcast. I'm really excited today to be with Pete Williams. Pete has a history and a background in exercise physiology. He went on to become a medical science degree practitioner and then has in 2004 became a functional medicine practitioner, perhaps one of the first here in the UK. Pete, it's so great to have you here on the show today.
Cheers, Ben. Thank you.
Yeah, it's a pleasure to be with you, and I'm excited to delve into some elements of your knowledge and to pick your brain a little bit to benefit our listeners. What was your inspiration to become a functional medicine practitioner, particularly when sort of 10 or 12 years before you'd gone down the route of exercise physiology?
Good question. So I suppose obviously I'm probably academic background degree-wise. I'm an exercise physiologist. Mm-hmm. I was working in London. I had a very successful practice, but I suppose whenever you work with a patient or an athlete, you soon realize that exercise is, I suppose, one part of everything that either increases performance or makes people healthy. And so I was always into what does the bigger picture show me? Mm-hmm. I was working with lots of other professions, physiotherapists, osteopaths, medical doctors at the time. And there was one real incident in particular, and that was an old osteopathic friend of mine just said, mate, you should go and listen to this guy. He's coming into London. He only comes in once a year. It's really right down your alleyway. Because we were, as a practice, we were into, I suppose, a sort of an integrated medical approach to everyone that we saw. And so anyway, I went to listen to this guy. This guy was called Dr. Jeffrey Bland, and he literally changed the way I looked at what I was doing, probably with his introduction, because it was the most eloquent introduction of why humans get cardiovascular disease. And it was completely different to, I suppose, the normal medical dogma that we knew. And that literally changed my working life pretty much from there. I wanted to know more. It absolutely resonated with everything that I was doing or felt or understood as far as how we looked at people, and really started that journey. 97, that was the first journey, and that was the start of it. I knew straight from there I needed to start to understand what functional medicine was and, what it did and how I could apply it. And as I say, that journey started 97. So,
well, yeah. I mean, you were very fortunate there to, what a name to see is your first step into the alternative health space. Jeffrey Bland is a significant player in that world for sure. He
is, yeah. I suppose everyone calls him the godfather of functional medicine, and rightly so. I think what that man doesn't know on that side, but it's not just that. So I suppose it's the way he translates all that evidence for you. It's almost like poetry when he's speaking, about science. And I just remember, wow, this is it for me. This has to be the route for me to go down. And so I did. Very very lucky that I've had the opportunity to go down that route.
Well, I've never seen him speak in person, but I've watched some videos with him online, and I've heard some of his interviews. And you're right, he's very gifted in being able to present and share information in a way that is understandable. So fantastic. Yeah. Now, one of the things that as we sort of move into this functional medicine space, one of the things that functional medicine tends to be built upon is this concept of finding the root cause, getting to the true basis of what is behind it. Why is this so important in functional medicine?
I suppose it always comes to, whether you're dealing with an athlete or whether you're dealing with someone who has chronic disease, you are treating not just the symptoms. You are treating the reason why the symptoms are there. And why is that so important? Why going to the root cause is if you don't find out what's the causative factor, you can't really deal with the underlying mechanisms that are driving the symptoms. And so, I look at functional medicine from a point of view, not what is it that we're dealing with, but why are we dealing with it? And what are those underlying mechanisms that will continue to drive symptoms? And so that's why, going for the root cause is so important, because if you don't actually find what those root causes are, the mechanisms that are driving the dysfunction or the disease or the symptoms will always be there.
I really like that answer. I appreciate your thoughts there. I wonder if I can play devil's advocate with you just for a second, because obviously when we consider what some mainstream doctors do is they do provide medication or things that help to manage symptoms, which in the short term help people feel better. It gets them out of a place of discomfort, maybe pain, feeling unwell. Is there some value to that?
Absolutely. I think, many people, if you particularly, pain patients, the first thing you want to do is get them out of pain. So I suppose with functional medicine, what you're doing there is that it's not just a consequence of let's treat the symptoms. I think treating symptoms is crucially important, because it gives you a strategy. It gives you a bit of a breathing space to then go on to deal with the root cause. So in many ways, I think that is always the profound strategy. When a patient comes in or an athlete comes in, there'll be some very simple questions. What do we need to deal with? And, it might be, I need to get out of pain. Okay, so what can we do to solve that issue while we're looking at why the pain is there in the first place? So for me, that is just good functional medicine. You absolutely look at symptom control, but then look at why the symptoms have got there in the first place. Excellent. So that would be the way I always look at a patient.
Excellent. I think that really sets us up nicely as a good knowledge foundation for where we want to go in the show today. We're going to talk particularly around stress and the impacts of stress upon human physiology and the body. And one of the key things, I suppose, anybody who's listening to this, when you've experienced stress, we're acutely aware of how you feel, the symptoms that present when stress is there. What directed your specific interest into this field of the negative effects of stress on the body? Because you've done a lot on this area.
Yeah, I really would put that down to that seemed to be the overwhelming mechanism of every patient that we seem to see. Now, of course, obviously, in a large central London practice dealing with executives, the adverse effects of stress was so apparent pretty much on every single case. So that's naturally what I got interested to. And look, the key thing is, as you know, is stress in microdosing is actually really, really beneficial for us. The sort of the patient specific groups that I was seeing, certainly on the executive side, it was just the unremitting consequences of far too much stress for far too long without any way or mechanism of getting relief from it, which is where the problems have started. So I think there's a misconception that stress is always bad. It's not. I mean, we can clear that's half the reasons how humans adapt and get better is that they, if they're exposed to a stress, I tend to call it a hormetic stress if we wanted to define it clearly. I think it's a great thing to do. It's just a question when that stressor is in far too much of an intensity, if we want to use that term, and for too long, with no way of ever recovering from it, it becomes a problem.
Excellent.
And that just comes from, years and years of seeing patients in that situation. And so that's absolutely where I got the drive to really try and look into this in a little bit more, because that seemed to be all the patients that I was seeing.
Excellent. I think that was a really great clarification. And, for the sake of the listeners going forward, we're going to be referring primarily to the long-term chronic effects of excessive stress load. We're not talking about all of a sudden today I was given a deadline and had to quickly respond to something.
No.
It increases stress. It usually increases performance, as you suggest, and we're able to deliver something in a shorter period of time. That's not what we're getting at. We're getting
I think if we redefine it, I would always take you to Bruce McEwen's work, Professor Bruce McEwen's, who came up with the concept of the allostatic load.
Right.
And if you like, the sort of allostatic load concept is really I suppose he defines it as the wear and tear that the wear and tear and the impact of stress on the body over time. And as you say, it's never a question of the amount of stresses that we're generally put under. It really is not having the ability to recover from the stresses. There is the major component of the problems I see.
Mm-hmm. I think maybe if we can step back a bit and let's actually define, what is the physiology behind stress? How does the body respond when a stressor presents itself?
Yeah, so and I suppose this comes into a lot of the conversations I have around hormones, I suppose. Mm-hmm. So it might be a really good idea that I take you through that, because that really gives you those absolute foundational understanding of just what human physiology is designed to do. And this really comes from some of the teaching that I've had over the years. And I suppose here's how I would explain it, is that human body really is designed to do, I suppose, one major thing. Its fundamentals is really to keep you alive long enough to reproduce. They're the two real fundamental things that we're really here for. Mm-hmm. And so staying alive is its number one priority, because of course if you can't alive, you can't do anything else. And when we look at the hormones, and I suppose when we're considering hormones, they exist in a big hormonal soup. Every hormone is, if you like, is talking and communicating with everything else. Mm-hmm. So they are never separated. They are always sort of getting an idea of what everything else is doing. But the key component of that is that the stress hormones are the hormones that tell you and keep you alive. They are the ones that in every second of every minute of every hour, they are allowing you through your senses to look around the environment and say to itself, am I safe or am I not safe in this situation? Mm-hmm. Because the number one key is, can I stay alive? And what are the risk factors at any one time that I may be exposed to? And so when you are exposed to a stressor, the stress hormones allow you to deal with that response. And because that's such a key physiological response, stress hormones always dominate the hormonal picture. And as a consequence of that, when you have stress hormones working hard over time, all the other hormones have to compensate, if you like, because we can't have all hormones working hard all the time without the body falling apart pretty quickly. But as a consequence of that, what you would see is that if the stress hormones are high, let me give you an example. 55-year-old male executive who comes in, he's in a highly stressful job, he's got a high allostatic load, he's got high stress hormones. It's normal physiology to expect that he wouldn't have optimal testosterone levels, because your body adapts to the circumstances by if certain hormones are high, other ones may be compensated.
So which hormones in particular are we talking? Are we talking cortisol, adrenaline? What are we talking?
Yeah, well, look, I think we've got two systems, haven't we? We've got the absolute immediate stress hormones. These are the ones where you've sort of drifted off in the car and then suddenly you realise that, you slam your brake on. And they're essentially the catecholamines, aren't they? They're the adrenaline, the noradrenaline. They are the immediate responses. And then, of course, after that, we get the cortisol release, which is that sort of slower acting adrenaline over time that tends to cause the consequences of the health issues that most of us talk about. Interestingly, isn't it, is that certainly when we look at some of these, fast-acting stress hormones, adrenaline, they're potent fat burners, and potent energy givers. And of course, that is something, again, that when we look at, stress makes you fat over time, I suppose there's a massive argument, well, depends what we're talking about. I think there's evidence to suggest that cortisol for sure becomes a problem over time. But some of those catecholamines are potent fat burners. But again, what I'm trying to get to here is that the stress response is a response fundamentally to keep you safe. But it is designed for, if you like, providing you with all the resources for you to get into a full-on scrap. The problem, again, is that when that full-on scrap is interpreted minute by minute, second by second, and sometimes this happens because people are in lives where the stress response never switches off. And of course, unfortunately, we don't have a brain that can interpret the different situations. The stress response is the stress response.
Sure.
And so being late for work, getting on the train that's busy, that starts to wind you up, someone's winding you up because they're on their phone. These are all fundamental stress responses that our brain is interpreting as a threat. And so, that is the consequence of how your body ramps up and tries to provide you fuel and the raw ingredients for you to potentially have a fight or flight. And that is unfortunately the unfortunate consequences of some of the lifestyles that we lead, is that stress response never really gets the chance to switch off.
Are we able to differentiate a bit there? You started to go into some, what I would refer to as extrinsic or external stressors. I think it would really be beneficial to get clear on the difference between intrinsic or extrinsic, internal, external stressors and how they might affect us.
Do you want to clarify what you mean for that, Ben, so I can give you a concise...
So I guess my thought is, an external stressor would be something outside of you, like someone else is getting aggressive, and then that has an impact upon you.
Yeah,
and an internal stressor might be, for example, that I have I've trained, and now my body's in a state of irritation or inflammation because of the effect of muscle soreness.
Yeah, so I suppose if we refer sort of the stress response from exercise, and again, this is where it comes down to, doesn't it? I suppose this is where it comes down to really understanding. So the stress response is essentially the same,
right?
But obviously, you would assume that the mechanism of doing physical exercise, which fundamentally is quite a huge stressor, will, if you can recover from it, have a beneficial effect. Now, that isn't always the case, because that is representative of a lot of the athletes, or I would say figure models that I see, that actually don't understand sort of strength and conditioning well enough, haven't periodized their programs well enough, and of course don't understand how much they are trying to improve at any one time, and usually overstress themselves and probably, if the term I'd like to use is probably overreach themselves pretty consistently, because maybe the stressor from an exercise perspective has been too great at any one time. And then again, they become, I suppose, intrinsically stressed from a point of view of that they don't allow that recovery process to happen well enough, and they don't give them enough time. So that could be, if I'm interpreting what you're saying, would be a classical indication of an intrinsic stressor. But again, how humans are set up, our personality types, our thoughts and feelings and perceptions of how we view the outside world, our interpretation of anyone's situation in the outside world, can also be quite a large sort of intrinsic stressor of the stress response, because just physically sometimes we don't know ourselves very well, we don't understand how we're going to interpret certain situations, and that can be a massive stress driver. It tends to be the major stress driver of a lot of the executives, from a point of view of misinterpreting or maladapting to situations in a day-to-day sort of workplace situation. So I don't know whether that's quite answered your question.
You've answered you've raised some great points there. I really liked when you said there about that exercise, of course, is a big stressor, but it'll only become a problem if they are unable to recover from that effectively. And it shows the importance of the ability to cope with stresses. Do you think there's variation between people in their capacity to cope with the stress burdens that they may face?
Yeah. And whether that is a combination of I'm going to use the word which probably is not very scientific, their constitution, and their constitution just might be, just some people are physiologically and emotionally just more robust to be able to deal with things. Yeah, I think that's quite apparent. But it's such a, I suppose it's such a complicated mix, and I suppose that's what makes, sort of athletic performance and recovery so difficult, because, not only have you got to understand pretty much physiology, you've probably got to understand a little bit of genetics, and then you've got to mingle all that in with the sort of the personality, how they view the world, and then we've got all the sort of, all the other processes from a point of view of understanding the appropriate strength of conditioning and cycle and a program of training at any one time. And this is where I'm quite keen for athletes to understand that I think where they get things wrong is understanding, and I'm going to use the term the allostatic load, because the stressor from training is just one big aspect of whether they're going to recover well enough. And I think you must understand where training fits within the sort of the bigger 360 picture of what actually is happening in your life at any one time will determine how well you recover from training. So it's not just the impetus of training and then, the recovery drink that you might want to give. It's all that aspect of understanding where you are from an emotional standpoint, from what else is happening in your life that may be a positive or negative contributor to the bigger picture of how we restore from training, and how ultimately we get ultimate performance.
Mm-hmm. Do you think then, based on what you've said there, you like to take a bigger view? You like to look at all aspects of someone's lifestyle, the way they live, their moods, emotions, their constitution, as you termed it. If you're working with somebody, are there key things that you look for that may concern you in relation to maybe there being a tipping point of somebody being able to cope or not able to cope with the stress?
Yeah, so let's give you a couple of examples. Imagine you've got two identical athletes from a point of view of genetics and training, if you like, two identical.
Sure.
But you've got one guy who lives on his own, has got some sort of, he's got some financial issues. He doesn't get out much, as opposed to his identical who doesn't have any financial issues. He's got a great young, loving family that he can go back to and interact. He'll get out with the dog. If we sort of broke all that down, we would be able to provide really robust scientific evidence to suggest that actually the guy who's the latter guy should recover better.
Because he's got good things that have a positive influence. Is that what you're saying?
Absolutely. Yeah. I mean, and these are the things that I think a lot of athletes are missing, is that they're missing the sort of the bigger construct of where the physical training fits within the bigger construct of, athletes and their lives, and what are the positive and negative impacts at any one time that come in. Because there's going to be literally hundreds, if not thousands, of positive or negative inputs at any one time, at any one day, that will either be beneficial or detrimental to the training process.
So, I mean, for me, that's really fascinating, because you've introduced here the concept of there are negative inputs in relation to things that you are doing or that you're experiencing that increase stress load. And so the removal of those negative inputs could have an improvement. But you've also said that there are positive inputs that can help you manage the stress load, and the lack of those positive inputs could also have a negative influence.
I'll give you some absolutely simple examples. Is that even if you live in it, and this is, it might seem a bit sort of off track, but imagine again two identical athletes. They live on very similar inner city council estates. The council estate that has more green spaces, if we look on a systemic point of view, and that athlete chooses after training to go and sit there for half an hour, the likelihood from the sort of understanding the bigger picture and how we can calm immunity and how we can influence hormones, you would assume from that theoretically that athlete would recover more quickly. So that's just a very simple, slightly skewed off idea of understanding that the bigger picture really, really matters. So spending time outside, what is clear is that, a little bit of sunshine is going to stimulate opiate release, which means that may have an influence on bringing the sort of pain response down in the athlete, as opposed to the guy who doesn't bother going outside. So, and this is something I actually wrote about reasonably extensively about 10 years ago, about understanding that, that how we need to look at our lives from a point of view of every single thing that we do or don't do can have a positive or negative influence on either how we recover from chronic disease or how as athletes we can influence the recovery response.
Yeah, fantastic. I really like some of those thoughts that you've presented there. I'd like to translate this a little bit now towards your typical fitness professional, your typical personal trainer, because most of those people are not going to have gone through the functional training that you have in terms of functional medicine. So if for those people who have a real interest, a desire to try and do something more to help their clients in the typical gym with their stress, any thoughts or immediate advice that you could offer on how a typical gym-based trainer could support their client in dealing with chronic stress?
So again, what have I found in all these years is actually trying to deal with an individual is, we're really complex mechanisms, and not only are we vastly complex because, if we look at where we are with the science, we're just starting to find actually we're pretty clueless about understanding just how complex we are. Not only how complex we are, when we sort of bring that into understanding stuff like the microbiome and then understanding how that all integrates with a very complex environment that will change second by second. It's really difficult. What I would suggest is that from my experience, and yeah, you know what, you might not have my functional medicine training, but what I've learned to do over the years is that how do I bring all this training to really simple strategies? And they are, regardless of what we're looking at, the basics are always the biggest. I think humans by nature want the magic pill, because that's sort of is the sexy thing. That is, what is it that's going to get me leaner? And the reality is it comes down to the basics, is that, we need to think about how we, I suppose, bringing some kind of awareness of whether they are actually stressed or not, I think is inherently important, because most of them don't feel as though they are, or don't quite understand that.
So how do we assess that? Sorry to interrupt you, but just thinking that through, because I've experienced that myself in the years as being a trainer, that many clients don't think they're stressed, or they don't want to admit that there's a lot of stress in their lives. But then when I talk to them and learn more about their life, you realize there's a huge stress load.
Yeah,
how do we then assess them in a more effective way?
So I think the key on that is that you've got to be able to have a relationship where over time you can, and I like to put it, you can start to get the story behind the story. I think if you do not have the capacity of developing a secondary and tertiary level about what's going on in these people's lives, you can't really get to do that. So I suppose personal trainers, if you like, is personal from a point of view of you start to buy into them, you start to buy into their life, and I think you've got to provide an environment where you feel as though over time they can start to have more personal conversations with you about where they are. If I wanted to give you some sort of mechanistic ways to think about stress and how you want to define that, I think mood status is a really great example, both scientifically and practically, where you can get that understanding of what's going on. And I suppose you when you've been doing it for nearly 30 years, you become even acutely aware of body language as it walks through the door. You are ultimately picking up those unconscious messages to say, this person's not in a great space today. Right. And I think they would be two great things to start with. Body language as they come in will tell you something. Mood status will tell you something. The way they either choose to engage or not into conversation at the beginning should give you, start to pick up those cues to think, things maybe are, not as good as they should be. People who are fundamentally skipping in the morning with great body language, who are happy, want to share a few jokes with you, or chatty at the beginning, in general will tell you something with regards to where their physiology is at. And so they would be really sort of easy and simple strategies, from the woman who is always happy, is always skipping in, has always got great sort of energy, to the woman who doesn't, should be telling you something about what is going on presently in their life. And that may lead you into, the opening conversation to say, hey, is everything okay? What's happening?
Yeah, sure. And I wonder, I think probably people quite intuitively see those things.
Of course they do, yeah.
But maybe haven't made the link as you've suggested. I wonder as well, whilst those things I think are vitally important, good communication, good observational skills to make some basic assessment of the individual, do you rate any particular type of questionnaire? What's your thoughts on things like heart rate variability as a way of assessing stress? Do you utilize those?
So what I'm going to say here is that whilst we will have, I think there are many, I think heart rate variability is a well-validated piece of kit to use. I think it's solid science, and I think not just, what I like about heart rate variability is that I think it's giving you an overall picture of overall health. So from that perspective, I really like it. I think one of the problems we have with medicine, and I think this is one of the, and I've been here because, I've gone through the process, is that I think we can get overly complex with using testing procedures, whether that is detailed testing through bloods or stool, or using stuff like heart rate variability. I think they are great tools to use, but I think sometimes they can overly complex the situation. I think if there's nothing more powerful than the ability for human to human conversation. And so I think, and you use the word intuition, I've just recently done a conference lecture where I talked about how a Mayo Clinic wrote a really great paper in 2013, which was all about how intuition can be used in sort of medical legal situations. What they're saying is that intuition is not something, what do they call it? Maybe it's gut feeling, I suppose is a good way to think about it. What they're showing there is intuition is not just something that you suddenly, you pick out of the air. Intuition is everything that you've learned over, for me, everything that I've learned over, and every situation I've been in with either an athlete or a patient over the last 30 years culminates into some kind of feeling or some kind of strategy that says to me inherently, my gut feeling is saying, you know what, there's something not quite right here. And so that's why I think, there's sometimes nothing as more powerful or as a sort of as a scientifically robust tool as intuition.
Interesting.
Because I think, intuitively, from a body language, from an unconscious perspective, you're picking up something that is telling you about maybe what is the right thing to do at the right time with that patient. So I'm a massive fan of testing and tools, but I think sometimes, remember, the testing and tools are just validations of where someone is at any one time. And no one gets better from a test.
Yeah, that's a good point. It's a snapshot, really, isn't it? It's a snapshot.
Yeah, I think, again, if we could learn on some aspects of what I've learned from doing blood tests, is that in many ways blood tests can be just a snapshot of what's going on at any one time in the day. And I think you've got to be really careful from trying to interpret what those blood tests are telling you from that simple blood test. I'm more of a fan of, okay, we're starting to see the same things that we've seen over the last sort of 3 months. So that tells me there is likely a process and an underlying mechanism that is definitely going on, as opposed to, I'll give you some examples of what I've seen in the last few weeks. And so I had a woman came in last week. She had a TSH at 5.6. Now,
suggest her thyroid's high.
It would suggest that maybe there is something going on with her thyroid function. Her TSH is slightly higher than it should be, which would indicate that maybe all is not well on the peripheral. So that maybe she is showing symptoms of an underactive thyroid. Now, usually you could make some decisions from that and maybe come up with some, either send her back to the GP or give her some protocols around that. But I said to her, look, let's let's not be hasty with this. Let's understand the context of where that blood test is. You know, you're highly stressed at the moment. There's a lot going on. Maybe what we'll do is make no decision at all. We'll bring you back in 3 weeks when everything has calmed down. We'll redo that test. So it's exactly what we did. And what did we find? A TSH came back into that line nicely after 3 weeks.
So you think that the metabolism was elevated as a result of everything she was undergoing at that point?
Yeah, and look, I bring you back to that hormonal conversation we had at the beginning, is that, you know, there is direct evidence to suggest that, you know, you may not ever have an optimal thyroid function when you're highly stressed, which makes complete evolutionary sense from a point of view of your body is making decisions on where it chooses to spend its energy, because in any one day you have this finite amount of energy that your body wants to expand, you know, wants to use. And so it's got to make decisions all the time. You know, if I'm highly stressed here, does that mean that I should keep optimal testosterone levels? Should that mean I should keep optimal thyroid levels? And the logic to that is that, well, no, why would I? You know,
exactly.
I said to you, when you come back to that process of thinking about how your body works, if I'm spending the whole day just trying to worry about staying alive, I'm not going to be worried about reproduction. So it's logic that when we talk about how stress affects hormones over time, it would be expected to see the 55-year-old male executive who's highly stressed with high stress hormones, it would be expected to see him with a less than optimal testosterone level.
Yeah, for sure.
You would expect to see a female with some kind of altered cycle. It's normal to expect. And the answer isn't dealing with maybe the fluctuations in estrogen and progesterone. You know, when we're talking about a root cause, the root cause is the stress levels they're under.
I see.
So you can deal with it, you can help people deal with the symptoms, but also you've got to get them to understand why those symptoms are likely occurring. And that's where, if you like, the root cause or the upstream sort of answer is that we need to reduce the stress levels, or we need to give you time frames where you can learn your nervous system to calm down. The biggest factor I see is that, you know, with most people, given the life in which we are overstimulated by life through wherever area that is in, Ben, it could be from so many. It could be from technology. It could be from, you know, the environment. It could be from the stresses and strains of work. Your nervous system gets wired for fight or flight. That's its role. It's an adaptive process. We adapt to what we're exposed to. And if all we're ever exposed to is stress upon stress upon stress, our nervous systems become what I call stress fixated by consequences of how we're living our lives. And therefore, what happens is that what's difficult for either executives or athletes to do is to go to the other side of what our central nervous system is supposed to do. We've got one side of it that excites us and gets us ready for fight or flight, and we've got the other one, which is the rest and digest and recovery, which is that parasympathetic. Yeah. And what happens is that if you never spend any time in that, your body just gets used to being in the other side. And as a consequence, over time, the allostatic loads get so great that we start to see the long-term consequences of that, which are the type 2 diabetes presentations, the hate to use the term, but adrenal insufficiency sort of type symptoms, you know, the inability to lose body fat, the inability to be able to sleep correctly. And therefore, that's where building those strategies are so important. But you've got to get to the point where you've got to identify to your patient that this is an issue. And whilst they seem to maybe, you know, and a lot of execs who are type A, you know, deal with stress really well. That's why they're good at their jobs, is because they just have this inherent mechanism. Well, you know what, you know, I don't really get stressed out. I actually deal with it pretty well. Well, my answer to them is that, of course you do. But that's why we're in the situation we do, is that because you're great at dealing with stress, but what you're good at is taking on abnormal amounts. And so it will have a consequence down the road. And those typically in the males are the ones that will go on to have the heart attacks. And
so the tipping point for those individuals is quite a bit further down the road, because they've got the capacity to keep going uphill for longer.
Yeah, and I think they're probably a little bit more robust, but they will be the typical male executives who have been given the statin, you know, a type 2 diabetic, have lowered testosterone levels, have the centrally deposited obesity, so they're really robust. But, at the end of the day, what you're seeing there is the breakdown over time of physiology and, I suppose, the clinical consequences of where that is going to go.
Yeah, that's really fascinating. We're kind of coming close to time, and I'd love to give our listeners just maybe one or two really usable tips. So let's use the example you've just shared there, Pete, of the executive who's overworked. He's showing some signs of maybe being pre-diabetic, things like that. And he's been working in this role for a long time. And we've got that person. He's now my client, and I'm a personal trainer. I've done my best to communicate, to interview, to understand. I can see all of those issues are in place. What have you found to be maybe the top one or two simple solutions to apply for this individual to help him deal more effectively with the faulty physiology?
So I suppose if we're talking those type of individuals, I think that's where testing actually becomes a key tipping point for change, because I know what I'm going to see on the testing with these individuals already. It's pretty obvious what I'm going to see. But sometimes people need it down in black and white to go, oh, okay, all right.
So you find for those people, data is a big motivator.
Yeah, because a lot of these people will be data and results driven.
Right.
So again, you've got to manipulate the sort of psychology of the way they view life to get your point across. And, I know what I'm going to see. So in many ways, I only use the testing to be able to put it on the table and say, you better choose what you want to do about this, because, the reality is things are moving in the wrong direction. And usually with them, the blood tests or whatever tests become the sort of the factor that makes them make a decision. So I think that's from those perspectives where testing is really good for. Not because of what the results is going to tell you, is because it starts them down the journey. But I think on anything, it's not your role as a personal trainer to make people change. They've got to be in the right environment to change, and you can only encourage that change by trying to show them that they need to change.
Agreed. So let's say they've had some tests, and the tests have they referred or whatever to somebody who did some testing. They now know that they have to change. Again, what one or two things do you think actually will help? I'm trying to nail you down to something here.
Yeah, well, look, I think on all of that, we can look at what we could do. We could give you these supplements to help you on this, and your stress levels are here. So why don't we use like a combination sort of Siberian ginseng with ashwagandha, and we've got some rhodiola in there, and we're doing all that. And that's great, and you can use that, and sometimes, that will work for people. But I'm going to give you the sort of 30 years of experience. It comes down to where are we going to get the biggest changes and the biggest wins? And they are going to be, in some way, shape or form, they've got to learn to come off the treadmill of the stress response. So as much as it's going to wind these people up, they have to identify what is wrong from their lives. And it's usually because they're time poor. But what they've got to identify is that where can they make some changes. What I'm also going to say on here, Ben, is that you have to be really good about what are the expectations of the results they can get in the situation that they're at. Now, I suppose from that perspective, that's difficult as a young trainer to be able to say this is what we'd expect. For me, who's had 30 years of it, can be very, very succinct and clear to them about expectation levels, and that's the sort of harsh conversation I will have with them at the beginning about what I think we're going to expect from where we're at. So if an exec comes into me and he's the guy who says, I want to lose a load of weight, but he's actually not prepared to make too many changes, regardless of what we do, the expectations of what he thinks and what I know he's going to get will be very different. And so one of the major problems, and again, a big message certainly for personal trainers here, is that a lot of times these people are they're successful because they're results orientated, and they think just because they're coming to see you and you're going to change a few things that they're going to get these massive results. And in my experience, that just doesn't happen. And so what happens then is that they get ultimately frustrated. You get sort of frustrated as a personal trainer because you're not quite clear about, well, why isn't this working? And that's because, as you say, you can only get an understanding through experience about what are we actually going to get here. Let me give you an example. I've got an executive I've worked with for the last 15 years. She's an amazing woman, but she chooses to live a life in a certain way. And regardless of how many times I test her and how many times we have conversations with her, she has now accepted what I say to her. And my line is that, I will see her 3 times a week physically in the gym. Right. And we've also got a full functional medicine program that runs around that. But based on how she still chooses to work in that environment, and all the money she spends and all the testing she's doing with us, she accepts now, based on the experiences that we've had and my communication with her, if we stop her from getting no worse, then we're doing an amazing job. But the days of her thinking that she's going to lose the 20 kilos with all that training and all that work that she's doing, it just isn't going to happen.
And you're saying that's because she refuses to adapt the basics in her life that would actually help her to make the progress?
Yeah, I mean, her fundamental issue is that she's sleep deprived.
Right.
And so as I keep saying to her, I said, until you move from 4 hours a night to 7 hours a night, we are fundamentally in a situation where it's nigh impossible for us to get those positive results. And what they've got to consider is that what we're doing is the best that we can do within that construct of the way she lives her life. So the fact that we are keeping her getting no worse is really an amazing job. And I think in the years that I've worked with execs, it's framing where they're at. It's framing those expectations of what they can and can't get, I think, has been the biggest skill that I've learned from that perspective. Because then, after 6 months when we've not gone anywhere, everyone's aware why we've not gone anywhere.
Sure,
it's not that you haven't gone anywhere. You've actually done an amazing job. You just haven't seen any changes in the results. Yeah. But what you've done is you've stopped these people from accelerating disease processes. And if you can keep some of these executives, like the word I like to use is treading water, you're doing a pretty significant job. Yeah. But you have to you've got to frame it right with the individual, because that usually is, they're not coming for that. They're expecting the 3 stone off. They're expecting, to be ripped by the summer. They're expecting everything else to be all okay. And there's a massive frustration when they come in and say, well, I'm paying all this money, and I'm not getting anywhere. And then the other thing I'm going to say with that is that human physiology is not linear.
Good point.
So it doesn't matter how much you're going to pay me. It doesn't matter how many tests that we're going to do. X doesn't equal Y when we do that. It just doesn't happen physiologically, because what we can never do is account for all the thousands or tens of thousands of external variables that we can't control.
Yeah, I mean, that's a really good point. I think that point of framing expectation is a really powerful message to kind of bring this podcast to a close, to be honest, because working with clients, like you said, they often arrive thinking, I'm going to pay this person and this personal trainer is going to get me to this point. They've already set in their mind what should happen, and it's very important as a trainer, as you've said so eloquently, to help that person understand what's possible and what may be a challenge because of various factors you've learned about them. And so that's a wonderfully powerful message, and thank you.
Yeah, and look, and people always want, what is the best thing I can do? And I think number one is learn to come off the stress response over time. I think that's really important, because then, as you say, things tend to work much better when you're in parasympathetic nerve state. Number two, which is probably the most profound one I see, is most people are sleep deprived, and you're really not going to get those results around weight control, around fat loss, around energy perspective, if you're not sleeping well enough. So
well said.
They're not people don't think they're the sexy things, but that's where all the action is. And again, I'm always looking at what is the biggest bang for my buck with regards to results. And they are trying to do the basics well. So yeah, you know what? You need to exercise really well. And I think exercise as a I suppose as a modality for health is probably the biggest thing we can do. I wouldn't say it's the most effective way to get people to lose weight on its own. And as a consequence, I think one of the biggest risk factors for personal trainers is to interpret what the research for the best way to get people lean is. If we look at the science,
Yeah, sure.
You know, what would you end up doing? You'd end up doing sort of probably high HIIT programs and probably, you know, high intensity hypertrophy training. But what I say to that, and again, this is something that I present a lot, it's good science, but it's likely applied to an individual where it's completely the wrong thing to apply for them.
Yeah.
Because, and what you're doing there is, you know, it's a bit like there's only so long you can flog a struggling horse.
Yep.
And so, you know, individuals who generally come in to see you are coming in to see you already battered down by life, and then you're going to potentially batter them even further down by giving them high intensity training, because by the science is maybe the most effective way to get people lean or increase muscle mass. But you've always got to take the science within the construct of the patient that you're seeing. And that's one of the biggest mistakes I see. And that will be that's actually quite a lot of, if you like, the corporate work that I get. People who have wanted to do the extreme changes and wonder why they're coming in to see me with, I suppose, chronic fatigue-like symptoms. And it's because what you've done is that you've got people under high levels of stress for many reasons, and then you've just put an even bigger, significant stressor over on top of them as well. And sometimes it breaks the camel's back with a lot of people.
Yeah, I would definitely agree with that. You know, there's no doubt that when we're applying those sorts of methodology, you know, HIIT training and high intensity hypertrophy training, it has to be applied to the person who has a relatively low stress load, like you said, so we don't overload them and break the camel's back.
And then you've got to apply it in a really well thought out, periodized process.
Totally agree. Totally.
Because one of the other things that I see is that people never seem to I don't even see any deload weeks on some of the people. So when I come to so if I'm having a conversation and say, well, how does this work? Is it that you're training hard for 3 or 4 weeks and then you have a recovery week, or and it's incredibly rare that everyone says, we're consistently building in these recovery weeks. It's just not a conversation that we had, and I think that is just because unfortunately trainers maybe don't have that sort of maybe more in-depth grasp of training principles, of how you periodize training, why it's so important. You've got to give people rest time, because the whole point about rest is recovery. And and the training stimulus is just that. It is a stimulus that is a very negative consequence to the body. So you're just putting someone in an environment where maybe they will get better from the training, but that's all it is. They've got to go away and they've got to recover in the appropriate way that you get the best out of the training. And that's what's missing. I think we are all about pushing people hard and with no real sort of process of thinking around, okay, so there's the stimulus for training. How do we get the stimulus from sort of moving forward from a point of view of performance? And that's all about recovery.
Yeah, I totally agree. And sounds to me like we've got a whole bunch of information there potentially for another podcast in the future, because
absolutely.
Because recovery is such a key factor to getting results. It isn't just the training. For me, the training is the stimulus, and we get better in between.
Which is exactly what it is. And I think I think most people understand that they think they get better from the gym. And of course, as we know, we get worse from the gym.
We do.
But we create a stimulus for change. And how we choose to recover from that determines how profound that stimulus for change, for performance, or for health is. And that's the crucial missing factor, in my experience with all the populations that I see.
Oh, wonderful. And let's wind it up on that great final comment. Pete, it's been such a pleasure having you here today. Of course, I'm going to link in on our show notes for all our listeners where you can find out more about Pete and his practice down in central London. We'll link in your website and everything else. So please go across to our blog, everybody, where you'll be able to find all the notes for this show and to learn a little bit more about Pete. Pete, it's been such a pleasure today. Thanks so much for your time.
Thanks, mate. Cheers.
If you enjoyed this podcast, please subscribe and share via social media. You can also rate the show on iTunes, Stitcher, or YouTube. If If you'd like to know more about us, then check out our range of online courses at www.nordicfitnesseducation.com.